Well, retired Kentucky teachers are fearing hundreds of dollars in increases to their health care costs if the governor's budget proposal passes. Thanks for staying with us at 5:30. I'm Rachel Platt.
And I'm Doug Proffitt. At least one lawmaker is blaming the retirement system organizers for not communicating that the Commonwealth was not legally responsible for the tens of millions left out of this plan. WHAS 11's political editor Chris Williams is in Frankfort, where the issue came to a head today.
Both sides agree that funding to help pay for Kentucky retiree health insurance is not in the state contract, but zeroing out what has been given out in past years has left some officials to warn of large increases in a cost that many thought they would not be facing in retirement. The Kentucky Retirement System Deputy Executive Director answered questions at the Pension Oversight Board hearing today as the retirement systems reported what they had requested compared to what was offered in Governor Bevin's budget. KTRS wanted $69 and $76.5 million in the next 2 years. The governor is allotting them no dollars. Budget Director John Chilton explained the decision.
There was just not enough funding to satisfy all of the needs and desires that people might project into the budget. And we knew that that was not subject to the inviolable contract. So funding was reduced to zero for that purpose.
People are just absolutely scared that they're going to have health care costs that way exceed their pension.
KEA President Stephanie Winkler argues that although the funds are not required under contract, since they've always been offered, retirees see them as a moral obligation. Senator Joe Bowen said it's a possibility that lawmakers will find the funds, but retirees have only their own retirement systems to blame for not knowing the contract.
That this is outside of the inviolable contract, that there was never any guarantee of that benefit. And that message, quite frankly, in my opinion, has never been appropriately articulated to the members of that pension system.
What kind of a difference are we looking at if nothing changes?
Well, this is just sort of a rounded kind of number. I think the single premium cost in the Kentucky Employees Health Plan is $660 a month, around there in the neighborhood. Retirees are currently paying $134 towards the cost of that. So, worst case scenario, if there were no funding or no ability to provide for any of that premium, they would be paying the difference between the $660 and the $134.
KTRS says they're crunching all the numbers and weighing their options as they await a final budget. It could take lawmakers weeks to reach a final deal. At the Capitol, Chris Williams, WHAS 11 News.